Okay. Well, thanks everyone for joining us today for this is one of our professional development webinar series that we offer throughout the year. And we're pleased to have our speaker here today, Sam Gillis. She's the Chief Program Officer with the National Runaway Safeline. Just a short bio about Sam. She oversees the programs and services for the National Runaway Safeline. They're designed to aid young people in crisis that have left home or experiencing homelessness. She has over a decade of experience serving survivors of human trafficking and sexual exploitation, as well as other vulnerable populations. Previously, she worked with the National Center for Missing and Exploited Children and the National Human Trafficking Hotline. Sam's passionate about supporting young people experiencing complex trauma and preventing exploitation. So we're so honored to have her here today to talk about new trends and what's going on in this area. And we will record the session. You can share this with your networks, your members, and then we'll also provide the slide deck as well. And if you have a question throughout the session, since this is kind of a small group here, you could put raise your hand or put a question in the chat box and we'll try to address it throughout the session. So with that, I would just like to welcome you, Sam, and let you go. Thank you.
Awesome. Thanks, Jody. And thanks everyone for being here. It's good to see some familiar faces and a bunch of new ones. Like Jody mentioned, there's a kind of small group of us here. So just use the raise your hand feature or put questions in the chat. I'm happy to do this as I go. I would ask, I'm sharing a lot of data. And so often what happens with data is your question will be answered probably like on the next slide. So give it like a second. And then if it's not answered, I'm happy to talk about it. But I promise that we will cover most of the major things as they relate to trends or insights with young people in crisis. So let me share my screen here and we'll get rolling. Okay. There we go. So as Jody mentioned, my name is Sam. I'm the Chief Program Officer here at NRS. I oversee the bucket of work that we do, really anything that pertains to the young people that are reaching out to us. So the crisis response team, our training, our quality assurance, and our resources and our volunteer base, as well as our interns. So all of those get kind of folded together. All are responding or responsible for the content that we are using to respond to young people in crisis. And I'm going to pull the chat over here. Apologies if you saw it. So that way I can see any questions that are coming up. So you may or may not have heard about NRS before, but just a quick overview of us. And we got the wonderful rundown of our history there from Ron. That was super interesting and helpful. I didn't know some of that. But NRS overall, really, we're just working to ensure that young people who have run away or are experiencing homelessness or facing crisis of any kind have a place to reach out to for us to listen. And so we could potentially provide resources with the aim of keeping them safe and off the streets. We provide resources, educational tools, training opportunities, really focused on that preventative side, as well as early intervention for young people themselves and then families or any supportive adult really reaching out on behalf of the young person. And in doing so, we also lead a massive awareness campaign every November, National Runaway Prevention Month, that we invite all of you all to be partners of, should you choose. And it's really aimed to shine a light on the issues that are impacting young people in crisis. As we operate various different programs, like I mentioned there, but our biggest program is actually our hotline, if you will. The hotline is actually the federally designated national communication system for young people aged 12 to 21 who are experiencing all of the things that I just mentioned. We are funded by the Family and Youth Services Bureau out of HHS. We have a cooperative agreement that we reapply for every 3 years, and that enables us to run that communication system. And each year, through the contacts from the communication system, as well as our other offline or online resources, we make over 125,000 connections to young people and their families, or any supportive adults that are seeking support or resources for young people. Okay, so there's two ways to really reach out to us or get connected to the resources that we have. One is through our hotline number, that's 1-800-RUNAWAY, and the other is through our website, 1-800-RUNAWAY.org. 1-800-RUNAWAY.org, there's different portals that feed you into the hotline. But there you can find our educational and promotional materials, our Let's Talk Runaway Prevention curriculum that I'll talk more about, but you can download that and grab that and take it to go. Our blog is also available on our website, as well as a link to our Let's Talk podcast. You can listen to those directly there. Jody and I were chatting a little bit about it right before we got on here, but the podcast really covers a range of topics, anything really intersectional with the runaway and homeless youth community or field. We have our youth advisory board members that will come on there and talk about issues that they may have experienced, or things that they see as really big barriers or opportunities for the field to respond to, areas of legislation that they think changing could create new opportunities or great impact in the field. So having them on. We also talk directly with a lot of different providers, whether they're in the RHY community or like the mental health field or any other sort of intersectional profession, really just looking at what is that inflection point of the work and where we can assist young people in crisis. Podcast is also available on all the places that podcasts are available. So I encourage you to check it out, like Spotify, Apple Music, all that kinds, or Apple Podcasts, all those places. Also on our website, we have connections to, I mentioned our hotline. So you can reach out through chat. You can access our crisis forum and our email service. And then when you reach out to 1-800-RUNAWAY, you're going to be met with a human every time. We're toll free, we're confidential, we're available 24/7, 365. And really I'll get into our model here in a minute, but really our aim is to provide trauma-informed solutions-focused crisis intervention for every contact that reaches out to us. And depending on the situation at hand, we can provide information and referrals for a variety of different circumstances. And then we kind of have these different tiers that we can add on to our crisis response. That can be our message service. Our message service is a program where young people can call in and leave a message for their legal guardian for us to then deliver to them. This is really helpful when a young person might have left home and they're not really ready to have that direct contact with their guardian yet, but they want to let them know that they're safe or that they love them or what the case may be, but they're just not ready to speak with them yet. We can act as that kind of intermediary. We can also do the reverse, where a parent or guardian can call in and leave a message for the young person that in their life that had left home. We will not call out to deliver that message for safety reasons, but if the young person can call in and check if word gets to them that a message was left for them here, they can reach out and check in and get that delivered on that call. We also offer a conference calling service where that more direct form of communication, where NRS can serve as a mediator between a young person and their loved one to really try to reconcile or work through some of the issues that they're having, with the aim of the young person returning home. That may take a couple calls, right? It may not be an immediate solution, but really that program is stood up to help facilitate that communication, help young people articulate their feelings, adults too, and really advocate on behalf of the young person. And then we also have our home free transportation program. This is a program that we have operated in partnership with Greyhound Line since 1995. And what it does is enables young people that have left home a way to get home for free. So we can issue a free bus ticket for a young person aged 12 to 20. And then guardian tickets as well, depending on the age. There's some stipulations around traveling with an adult or an older young person. So we can help facilitate that and get a young person who might be, across the country back home, or, even a couple hours away. That's a really awesome program. And if you all have not heard about it before, I'm happy to answer more questions at the end about it, but that's one of our most popular programs. So I mentioned kind of the trauma-informed approach that we take to all calls. Really, we follow this model that you see here on the right. It's a 5-step solutions-focused model that incorporates trauma-informed care as well as harm reduction, elements of positive youth development, and solutions-focused brief therapy as well. Really, the aim is to move through these steps here, recognizing that conversations are not linear. These are very cyclical. We kind of jump around in between these. But the aim is to move through really working to establish rapport, explore the facts and the feeling that the young person might be having, zeroing in then on the main issues or the most salient issues, the ones we can address right now, or the ones within a young person's control. And then from there, exploring options and really exploring viable options with the young person. And then based on all of those factors, really working to establish a plan of action for next steps that the young person is leading. They're in charge of making their plan, and we're there to help them kind of brainstorm and walk through things and develop a plan B, and let them know that they can reach back out if that plan doesn't work or things change. I mentioned the information and resources, so I'm just listing a bunch here. By virtue of operating the National Communication System, we also serve as this national database for the Runaway and Homeless Youth the FSBE funded agencies. So we have a database of over 7,000 agencies that include all of those programs. It's the first 4 that you see here: the basic center shelters, transitional living programs, maternity group homes, and street outreach programs, and with them, a lot of their drop-in centers. But we also have resources for agencies that might not be funded that way. Really, this database is a catch-all for anything that a young person experiencing homelessness that has run away or is considering running away or is going through any sort of crisis that could propel them into those circumstances. That database is meant to be a safety net for resources for them. So while we are a national organization, we have this kind of its national scope, but local focus. So a young person, wherever they're reaching out, can get assistance for whatever they need, as well as providers if they're working with a young person, maybe in Chicago, but they're trying to get them into a transitional living program or get them connected with mental health resources in another state. We can help provide information and get them set up somewhere else. I'm going to share towards the end of this presentation a link for joining our resource database. So if your organization is not listed within our database, we would love to get you included. And then this is another program that I mentioned that we have here, our Youth Advisory Board. So we have a group of probably 10-ish young people. We just went through some recruitment that really provide us with a wealth of information and expertise. So in order to be part of our Youth Advisory Board, you have to be a young person that is 16 to 23 at time of applying, and have a lived experience with leaving home or being locked out of home or experiencing some form of homelessness or housing instability, and be able to commit to kind of the meetings that we have throughout the year. But really the goals of this board they're reciprocal. They're meant to provide NRS with the firsthand knowledge and experience of young people that have experienced those things. We really want this to inform our programs from the ground up, not just do more of like a youth approved fact checking at the end. We want them to be integrated and informing all that we do. And really working towards, as adults, we can have a good idea of, we can interpret the trends, right? We can think we know what they mean. We can align our priorities based on what we're seeing. But that's one piece of the puzzle. And we want to make sure that young people are informing what our priorities are. we also want to make sure that young people, we might have priorities, but our strategy or our plans for addressing those priorities might not resonate with young people, right? So we want to make sure that young people are informing like what those communications plans look like. If we think like what we think our approach is, we want them to check us and tell them that we're on the right track, or maybe they'll say that that's actually not the right track at all. So we want them informing not only our priorities, but how to communicate about those priorities in ways that will resonate. And we also want to provide this reciprocal piece of our youth advisory board members are paid for all that they do, every piece of insight that they give us. So we really also, in addition to that being paid for their time, we also want to provide some professional development opportunities for them, whether that is training, speaking engagements, attending really important events. We had a couple of our youth advisory board members actually sit in on a White House panel that was held up in response to the executive order around LGBTQ youth last summer. So really exciting opportunities for them to share their thoughts, their expertise, and be in the room with decision makers in order to push the RHY agendas forward. So that's just a little bit about us. I'm going to now get into our data and the meat of what we're here to talk about. So we're a data-driven organization, and we really rely on the information that we're getting to help inform our next steps and to provide really strategies and recommendations for not only what we should be doing, how NRS should be responding, but also provide some insights for the RHY field. I think it's also really, we're in this unique space of we're not only responding right to young people that might have left home for whatever reason, or might be experiencing homelessness. We kind of exist on this continuum of where we are responding to young people on that tail end, but also very much so on the front end, where young people are considering leaving home, and we're part of that like thought and consideration process. So we get a really robust data set there as well. I will note all of our data is voluntarily reported. So when young people are reaching out to us, we're collecting data as it's shared in the conversation, as it's proactively shared. When we're collecting it, or when we're asking specific demographic type questions or issue-based questions, it's in the context of how we can serve them. How can we assist, right? We're not going to outright like ask somebody about their race during the context of them sharing a crisis situation. It might come up if that's related in some way to the crisis they're experiencing, but we're more so asking questions about, if you're experiencing homelessness and you're reaching out for a shelter, asking age to figure out if you meet the criteria to enter those places. So that's how a lot of that information is coming up. And we're getting a lot of information about why young people are reaching out and how we can better serve them. This allows us to not only talk about kind of the trends and insights that we're seeing retrospectively, but it's also kind of allows us to start to forecast a little bit. And I'll get into that in a bit here. And then I should mention, every year since 2019, we've been partnering with Chapin Hall at the University of Chicago to really analyze our data set on a deeper level. And we publish an annual crisis services and prevention report. You see the 2021 there in the image. Our 2022 data report is going to be available this summer, probably late summer. And all the data that I'm going to go over today is kind of a sneak peek at some of that, but the report will be available and you can access that once it is live. But in terms of the national data set, we had 26,000, just north of 26,000 crisis contacts this year. It's on the lower end than we've experienced in the last 2-ish years. There was, in the pandemic kind of era, I guess we'll call it, from 2020 to 21, those 2 years, we were kind of more so around 35,000 contacts. So it's gone down a little bit. And I think we're still we're kind of in this reactive mode of seeing, is this just dipping down this year? Is it going to pop back up? Like, is it reactionary or not? So it's a little too soon to tell. But prior to 2022, the numbers were slightly lower, and they usually are kind of around this like 30,000-ish total annually. So it's kind of too soon to tell. We'll see. But what a trend is over the last 4 years plus, we've seen live chats be our preferred method of outreach. So young people prefer to chat us versus calling. Calling is our second most used form of outreach. However, we see that it skews like kind of towards the older callers. And as we see live chats going up, the percentage of people using that as a preferred service, we see the others kind of going down, but not at the same rate that live chat is going up. We're also going to be launching a text line this year in a couple months. And so we foresee the texting service becoming a preferred method of outreach as well, and calls probably dropping a little bit down. But those aren't like, as one goes up, the other's going down at the same rate. But just something to be mindful of, and I think translates into other professions or other circumstances as well, as we're seeing kind of across the board, young people preferring this digital option of outreach. Emails, we get about 4% of those out of our total crisis contact volumes, and then forum posts also 4%. I will speak more about forums a little bit later here, but what I want to note is that the 4%, what we're counting is unique posts. So like just if you think about a traditional forum, somebody asks a question, people can respond. The 4% is like a new organic post. This isn't counting the number of people viewing it, right? And there's a lot of value in that as well. When looking at the map here, the map's not super, I don't think it would surprise anyone. These areas of darker green are where we have more volume, and I like to call them the usual suspects. It's the bigger states with the big urban centers. There's a greater population in these areas. There tends to be more calls. There kind of always will be that way. Heat maps kind of often reference more the awareness about your services, right? Not necessarily the need, but this is largely reflective of kind of the population. What we do like to note here, though, is that this map has changed over time in the sense of like the middle of the country is becoming darker and darker green. And that means there's more awareness about NRS that's getting out there. And we hope to see that continue to shade a little bit darker over time. And I mentioned here, digital outreach is preferred by young people. So it's not super surprising that we see most of the contacts that learn about us do so through digital means. You'll see here, internet is 74%, and then followed by a previous call, maybe at a different time, and then word of mouth. Word of mouth, I think that between internet can be difficult to distinguish. It may not be, some might bleed into the other. Because young people a lot of folks are making friends over social media, right? Or seeing us post something over our social media. And so that kind of depends on a young person's definition of how they heard about us. A young person could say, like share something on Instagram or TikTok that they heard about us. And that could be counted as word of mouth versus internet. So we just like to note that as well. And we see that this trend is going to stay. Internet is by far the biggest way that young people learn about us. Okay, I'm going to move into some demographic data. This graph is representative of the contacts this is the age of the contacts that are reaching out to us, right? It may or may not be the age of the person in the situation that is being discussed. Most of the time, those things are one and the same. North of like 75-ish% of people that reach out to us are reaching out about themselves. It's actually a young person reaching out about themselves, but sometimes we have adults reaching out on behalf of a young person or about a young person. So this age graph is reflecting who's making the call. So year after year, we see that age 15 to 17 is that it's the biggest group of individuals that are reaching out to us for support. And then this on the far right, 22 plus. So an adult reaching out might be about themselves, right? We do have some services while we are our target audience, but most of our funding is for young people aged 12 to 21. We are definitely serving folks that are under 12 and then folks that are over 21, because we recognize the needs don't just stop. And then especially in the field, right, there's that up to 24 is really where we see the services kind of change. So this 22 plus group, there's still a large portion of young people that are reaching out about themselves in that group. And then some might be adults calling about younger youth. But what we've also seen, in addition to that, like 15 to 17-year-old group over time, the past 4 years really is that under 15 group, so under 12 to 14, really starting to rise. And especially within the last year or so, the youngest group under 12 is going up quite a bit. We don't know why that is. It could be, there's a lot of reasons that could contribute to that. It could be because there's a greater need earlier, but it also could be, and what I suspect is more the case, is awareness is starting earlier. Young people have access to more information, things like TikTok, mental health, these quick little snippets, right? Young people are starting to be able to digest really big things in shorter periods of time and get resources faster, or get more information about where to reach out for resources. So we are seeing that younger group reach out to us at a higher rate. As far as gender, young people that identify as female are often the largest group of individuals that reach out to us. Followed by male at 21%. Unknown here, we have 9%, and then transgender and gender nonconforming both at 5%. We have seen an increase in young people that identify as transgender or gender nonconforming increase over the past same kind of 3-4 year period. And I would say same kind of thing as it relates to age. I can't say definitively why that is. But we do know that young people that identify as transgender or gender nonconforming are sometimes overrepresented in the populations that are experiencing homelessness. It just necessarily wasn't reflected in the data in terms of outreach. What we think this increase is more so reflecting is awareness and trust and safety in us. So we don't think that there's necessarily more young people that are identifying this way that needs help. I think they just feel more comfortable reaching out. Our engagement efforts are working. They feel like they can reach out to us and that they'll be met with understanding, non-judgment, and we can provide them with resources that might be able to assist. Again, that is an inference, but we don't have the information to necessarily say why. This is just reflective of young people that reach out to us. As far as race and ethnicity, you can see at the bottom here, we have quite a bit of unknowns. This is not uncommon. We generally have a pretty big bucket of unknown, and that is reflective of what I mentioned before. We're asking questions about young people reaching out to us as it's relevant to the situation at hand. It's often not relevant in terms of us providing a resource or a referral. And so we don't want to ask that information. But sometimes it does, a young person might share it. It is a pre-chat question that we have, like a pre-survey question, and young people can fill it out if they choose, and some do. But there's a lot of reasons why somebody, right, may or may not feel comfortable sharing their race. So I just want to note that that's why that bar is so high. But of the information that we do get, we've seen this shift quite a bit over time. The largest bar here is young people that identify as white or Caucasian at 31%, but this has changed more so within the last 2 years. they used to represent the majority of contacts that reached out to us. So over 50% of what we knew or where we had an identified race or ethnicity provided, but that's shifted. So now that the sum of the other races and ethnicities supersedes that 31%. And so to my point more about gender, this may or may not be reflective of the need. It might be reflective of awareness in our services and trust in reaching out to us by virtue of the engagement that we're doing in different areas and trying to really appeal to a wider set, a more diverse set of audiences and folks that we really know, as I mentioned, are overrepresented and that do need these services, but traditionally haven't been as represented in the data in terms of who reaches out for help. That makes sense. So where are young people when they reach out to us? We saw this shift a lot over the pandemic, and it makes sense, right? We were stuck at home during that time. We had I would say 70% of young people, maybe even more, reaching out to us from home. That's dropped down to 42%. It's even less so though in 2019 pre-pandemic. We were around 50, 51%. So it's dropped down, and to the point of I was making before of total number of outreach, this could be some weird bounce back period, but it may not be. It's something that we're going to have to see over time. But as it stands in 2022, what we saw was 42% of young people reaching out from home. That's still, even though it's not a majority, it's a solid chunk of young people reaching out to us before they've left, right? So it really speaks to the need to focus on prevention and this really great opportunity for us to prevent episodes of homelessness and all of the other risk factors that come along with that once you walk out the door or once you're not in a safe space. All of that, recognizing that, right, sometimes home is not the safest of spaces. But just because it is such a high percentage, it's something that we really want to focus on, aiming our prevention efforts and working with young people to see if there's possible alternatives to leaving homes or ways that we can mitigate some more adverse consequences or serious consequences once you leave home. So the youth status at time of contact, it's not like an apples to apples comparison here. It doesn't mean the location. So youth in crisis that you'll see there, the other 5 categories relate to kind of a housing situation. Contemplating running means they are still at home, but they're considering leaving. Running away means they've already run away. Homeless means experiencing homelessness. And then the other 2 are also self-explanatory. But youth in crisis means they're reaching out in crisis and they haven't mentioned something about wanting to leave. So it's not tied to being in the wanting to leave home. So that could be they're struggling with their mental health, but it's not prompting them to want to run away. Youth in crisis is always our number one reason or our number one status category, followed by contemplating running away. But traditionally, these 2 figures, the first and second one, they've been closer. And they're starting to kind of separate a little bit more. We're seeing more young people in crisis, and then followed by contemplating running away. And there really used to be within a couple percentage points. The issues that are identified, these are the top 5 of what young people are sharing as their reasons for outreach. Family dynamics is consistently in the number 1 spot. It's always around this high 70s, low 80s number. I think last year it was 85%. And the reason being is family dynamics is a really broad category. It's anything relating to something going on in your family. And I should note that all of the categories that we collect, they're multi-select, right? Young people are very dynamic. They are experiencing a lot of different things. You could be experiencing or citing every issue listed on this chart or listed on this slide right here. But family dynamics is one that can pertain to anything ranging from issues with rules, not agreeing on something, to struggling with kind of a step parent or a new person entering your family, to maybe physical abuse and assault perpetuated in your home. So it can be a lot of different things. And that's why that is so broad. And also why that percentage is so high. Emotional and verbal abuse is pretty consistently as well. Our second most common reason for outreach. And 2022, that was at 28%, followed by mental health at 25% this year. So mental health in the past 3 years has entered the top 5 reasons for outreach. It's really important though, because pre-pandemic, so pre-2020, in our data, mental health hadn't peaked into the top 5 for decades. And so it's something that we're paying a lot of attention to and responding to accordingly. Again, we can't say why that is. Is it a result of the pandemic? Is it a result of a lot of the mental health awareness that came with the pandemic? We don't know. All we know is that young people are citing it. And then in 2022, economics, this one's new, has jumped into our top 5. The economics hasn't been in our top 5 for quite some time as well. It was 23% in 2022. And then physical abuse and assault was in the 5th spot at 17%. It's generally our 5th category. Sometimes switched out with peer or social issues. So just anything going on with friends. Those two can sometimes flip-flop, but they're usually kind of within a percentage point or 2 of the 5th and 6th top reason for outreach. But since we're here to talk about mental health, I want to dive into, these are broad categories. I want to dive into some of the subcategories that we have for mental health. So at a national level, in 2022, depression was cited. So of contacts that mentioned a mental health issue, 49% cited depression as a reason. And like the broader issues, sub issues are also multi-select. So there can be a lot of different things going on. And that's why all of these don't add up to 100%. So depression means the young person is citing depression, feeling generally sad. I want to just mention that we're not citing this as like a clinical diagnosis. This is just feelings of depression. It may be related to a diagnosis, but we don't really get into that unless it's shared. Youth mental health issue, general, that was cited at 39%. Really what this category means is that they say they're struggling with their mental health. Often there's other things clicked, or this area could be a mental health issue that is not represented by the other subcategories here. So it's kind of like a general other catch-all type category. And what we're kind of doing is evaluating that one to see what are we hearing come up a lot, and are there other subcategories that we could start to pull out there to gain some more insights about why young people are reaching out, or what mental health issues are most relevant or expressed. At the third category here is a young person stating that they're suicidal. So that could be anything ranging from being actively suicidal to having thoughts or feelings of wanting to take their life. That's at 25%. It's really, really high, super concerning. That's something that we're doing a lot of due diligence on to work on vamping up our resources for young people that are suicidal, providing increased training to our staff to be able to really respond to that emerging need. Below that, you'll see that self-harm is cited 12% of the time that mental health is mentioned as an issue, as well as 8% of young people that have mentioned they had a prior suicide attempt. And you'll see the other ones here, but really what I want to draw your attention to is the suicidality. The 25% has been up there for the last at least like 2 years. And we're keeping a really close eye on that and responding with training and resources, as I mentioned. I'm going to just quickly go over our social media data so we can go over Illinois. Really what I want to note here is more of the forum visits and our engagement generally. I mentioned a lot of our trends could be reflective of increased awareness. And we think that that is because we are more and more so becoming more prolific in the places and spaces that we know young people are and that providers are. So you can see we had over 1 million impressions across our social media platforms. A lot of those are on TikTok. That is where young people are, right? Over half. That's over half of our impressions are coming from TikTok. So that could explain the increase in young people reaching out earlier. That could explain why young people of different backgrounds and races are getting information that they might not otherwise have, right? So it's just something that we like to note, that social media can go a long way in terms of reaching the folks that we are trying to reach. And then, as I mentioned, our forum before, where we're counting in our crisis contact data, the new posts, the new questions. We have a ton of forum visits though. And that's super important because young people, it takes a lot of courage to reach out for support. And there's a lot of testing the waters that kind of goes into reaching out for support. We see last year we had over 170,564, that's how you say that number, visits to our forum. And then the breakdown here by topic. So legal issues is number 1. That's questions like, is it illegal to run away? How can I get emancipated? Is someone going to get in trouble with me if I stay with them for running away? Those kind of questions are in there. Followed by family issues. And as I mentioned, family issues is the top reason for outreach to the Safeline. So young people are visiting the site and reading those forum posts, potentially getting answers to their questions so they don't need to reach out, potentially sussing us out to see if we're legit and we're going to help them, right? So the forum can go a long way to either get folks the answers that they need or to start building up trust and providing the courage for young people to reach out and have that one-on-one conversation. Okay. Any questions about the national data before I jump into Illinois? Okay. So we're going to look at the same time frame, so 2022 for Illinois. There was, as I mentioned, a little north of 26,000 contacts for the nation. There were a little over 1,000 within Illinois in 2022. And the trends for the modes of outreach are quite similar. Live chats for the nation was 59%, and for Illinois, it was at 60%. So digital is preferred. Hotline calls were a little more so than the emails and forums, but second place at 39%. You'll see the top 5 counties at the top there. So no surprise, Cook 53%. So of the 1,000 contacts, about like 500 or so are from Illinois or from Cook County, followed by DuPage, Lake, Will, and McDonough. I'm not from Illinois, y'all. So if I said that wrong, please don't hold it against me. But the Home Free program that I mentioned, where Greyhound can provide that free bus ride home. There were 7 tickets issued in 2022 from Illinois. So we could up that. We could up that a bunch. Yes, Ron.
I don't see the Illinois data. It's in the black. Okay, it's on the top.
Yes.
Okay.
Sorry if that's hard to see.
That's all right. No, I've got glare from the window on my screen.
Oh, okay. Yes. And we can break these down further. I didn't mention that. I think it was on the slide, but I don't think I said it. If you are interested in your specific county or your city, even zip code, if we have enough data, we can drill down to the area that you're curious about. So in a populous zip code, we'll have enough contacts to do that. But if it's an area where we have like 1 or 2 contacts, we're not going to necessarily share that information. It's too identifying. But if you're curious about what your specific area looks like, we can create a similar kind of snapshot of all the information I'm going to go through for you all. Okay. So the trends are pretty similar here as well. 40%, so it's only 2% less of young people that were reaching out to the Safeline were at home at the time of outreach. 44% were in crisis when they reached out, and 23% were thinking about leaving home. And then 18% had already run away, and then 15% were experiencing homelessness. These are the runaway and homeless sections they're a couple, like 2 or 3 percentage points higher, but by and large, pretty consistent with the national data. In terms of age, this graph's also quite similar. Young people, that main group of young people that are reaching out to us are 15 to 17 years old. And then young people under 15 are reaching out as well. It's slightly less actually in Illinois. It's young people, this under 12 category to 14 for the national data set is 20%. This is 10, 18, so really close, but just slightly less. But you'll see the 18 to 21, that's slightly higher than the national average. In terms of gender, this is pretty on par as well. And I think a lot of this speaks to 1,000 contacts in one state is a lot. Illinois is, I think, fourth or fifth highest, our fourth or fifth state with the most contacts. So a lot of these trends are going to be pretty representative of the national data set. I think transgender and non-conforming here, this is at 13, whereas the national data is at 10%. So slightly more contacts that identify that way. In terms of race and ethnicity, we have less numbers of unknown here, but slightly more individuals that identify as white or Caucasian compared to the national data set that was at 31. Illinois is 42. And then slightly less contacts that identify as Black or African American, and I think pretty close to Hispanic or Latinx. And then in terms of issues that are identified, family dynamics, same spot, number 1, always is, but mental health is in the second spot versus versus third nationally. So that's something we want to pay attention to. So of all of the contacts that reach out to us, 31% of people are saying they're experiencing a mental health issue. And that could be the reason for outreach. It could be there's another reason for outreach, and this is connected to that. We don't always know kind of like what the chicken or the egg is, if you will. That will play out at an individual level, but in terms of really analyzing kind of the data in this way, right? It could be I'm experiencing physical and emotional abuse at home, and by virtue of that, I'm experiencing a mental health crisis, or it could be a mental health crisis exclusively on its own. There's a lot of different ways it could look. But what's important to know is it's mentioned 31% of the time. Economics is also nationally in the 4th spot, but 3rd in Illinois. That emotional and verbal abuse, that's 2nd nationally, is in the 4th spot here, so moved around a little. And then physical abuse is in the 5th spot. Want to look at really quickly here the age of the callers that are citing mental health as the reason for outreach. So if we go back, this is the age generally of contacts that are reaching out writ large. That follows that national kind of arc that we talked about. But the age of contacts that are reaching out about mental health specifically looks kind of different. You'll see that there's more of a spike in the younger group here, the 12 and 13-year-olds. This is 22% in itself in Illinois. So that's really important to pay attention to. And then this spike of adult callers reaching out either about themselves, they're 22 to 24, or they're reaching out about a young person in their life that's really struggling with their mental health. But I think what's really key here is this 12 to 13 age group. Because, right, like the way that we respond and interact with young people age 12 to 13 can look vastly different and should look vastly different than how we're responding to somebody that's over the age of 22. The issues that are being cited in Illinois, the general youth mental health issue is at 43%, followed by depression. And youth suicidal is about the same, kind of, it's 2 percentage points less than the national average, but still very, very, very salient of an issue that should all be top of mind. And then the options that we discuss when somebody is citing that they're having a mental health issue, we really try to work with those informal supports first. Is there a family member that you can talk to, especially if we're thinking about this younger age group, right? A 10, 11-year-old can't just walk in and get treatment somewhere, right? And depending on where we're talking in the country, there's different varying levels. I don't need to explain to you all the varying levels of consent for when and how and for how long you can access mental health support or health support in general. It varies state to state, county to county sometimes. So we're working to identify, is there somebody that can help you, that you know, that you trust, navigate this with you? Who's a trusted adult that could do that? But we also refer to law enforcement. That could be an imminent risk type issue. Other support hotlines, as well as mental health professionals directly, and then alternative housing. If that, this is reflective of like kind of the situation at whole, where mental health is cited. So there could be other things going on, or one issue superseding another that could lead us down these referral paths. But really, these are the ones that are getting mentioned within the context of mental health being mentioned in a situation. I know that we're like really short on time, but I just wanted to briefly go over kind of how we're responding to all of this. Is really drawing on the expertise of our youth advisory board, incorporating them in all that we do, getting feedback, adjusting our priorities and the way that we communicate about things in kind, adding additional training to respond to that younger age group, and do so in a developmentally appropriate way. Additionally, expanding our resources to young people, whether that is the tools for younger age groups or increasing our mental health providers in our database, as well as mental health tools that younger folks can use. Broadening our social media outreach and the ways that we're engaging with different groups or subpopulations to best resonate with their needs and build trust. And then we're updating some of our prevention materials, our Let's Talk materials. And then we're also developing a crisis prevention training using the model that we do internally for our staff. We have a 40-hour training that we have truncated down into 8 hours, and we're packaging that so it's available outwardly for any youth serving professional. And we should have that available by 2024. And then I'm not going to really go through our prevention and education information, but it is available on our website for free download, or you can order materials. So just check out our website, 1-800-runaway.org. And there's a prevention and education section where you can find all of that stuff. And that's where you can find more details on our Let's Talk runaway prevention curriculum available for ages youth 12 to 20. It's, as it sounds, meant to educate youth on alternatives to running away and building life skills up and doing so. You can use that as a curriculum, as a whole curriculum, or and module by module, kind of like a la carte, depending on what you need and the topic at hand. And it's free, so you should check that out. This year, we are incorporating a mental health a mental health module that was not previously included. So we're really excited about that. That is in the works and should be available by the end of this federal fiscal year in October 2023. And then I mentioned the training that we're creating, the prevention training. It's going to follow our model and be available to youth serving professionals. So as I mentioned before as well, if you're not included in our database, I would love to get you in there. That is also on our website under the service providers tab. There is a little link to partner with us, and we can get your organization listed in our database. So I see some questions. Kim had to go, and that's not a question. So do we have time for questions? Sorry, rush in there at the end.
Yes, there's time if folks want to ask a question. We can stay on. Ron, you've got a question?
Yeah, how
Yeah.
does this, how do you interact with now the new 988 number?
It's a great question. So we can, 988, we certainly refer to. We've found that 988 is more helpful kind of on that older tier. It's really designed for more so like adults that are experiencing those crises. We often serve as a solid option for dealing with that in-house when it's on the younger side. So we work with 988, we refer to 988, we have relationships with 988 where we can backdoor kind of into their hotline. But if it's a young person that's reaching out for support or going through a mental health crisis or has articulated thoughts of suicide, we're going to be working with them directly.
Well, I was thinking the other way. Are they sending people to you?
They do sometimes. Yeah, they do. It's still very much in flux, right? Like everyone's still getting the hang of 988. So I couldn't really tell you offhand if there's like a trend in age or under what circumstances they're referring to us. But we are getting some for sure. I think time will tell if it's like a certain area or a certain age group or what, but yes, we're getting them.
Okay. And do any of the mobile crisis response agencies that respond in a crisis, on a mental health crisis, do they refer to you as well? They typically have what in Illinois is called the SAS services. You know, whether or not a youth needs to be hospitalized in a mental health setting or not, and they send someone out. And so do they refer to you as well?
They may have, but I haven't heard that really being a trend. So it hasn't emerged as something that's on the radar, but that's something I can certainly put on the radar, look into.
Okay.
But I haven't heard that come up as much.
When you had mentioned the Illinois data that was specific with the counties, and would our members be able to access that, or how would they go about if they were interested in getting that data for their specific county?
Yeah, that's a great question. They can shoot me an email. I'll put my email in the chat here. And you have it too, Jody. You can certainly share it with folks. We will soon have the state level data up on the website that folks can just pull down. We have them downloadable, ready to go. But anything more granular, it's requested.
Gotcha. And then the crisis prevention training that you were mentioning for the youth service organizations, is that going to just be open? I mean, like a sort of a registration option or something like that?
Yeah, so that training is very much still in content development. I just did a pilot training, the first one on Friday. So we are going through a series of like focus groups and getting feedback before it's finalized. The rollout of that hasn't been fully fleshed out yet. But likely what's going to happen is there's going to be some trainings available to RHY providers first. And then we'll probably have set points in time where it's open to others. But it's not going to be set up in the fashion of Let's Talk, where you can kind of download it and grab it, facilitate it on your own. It's going to be, I think, for a bit of time, more of like an NRS-led session where we'll have certain points in time set up.
Thank you.
Of course. Yeah. Thank you all.
Any other questions from folks?
Other than I want the link to this recording, and I'm going to send that to the agencies that we fund that have youth services, as well as look forward to the other things you might have. We're doing our needs assessment in the next fiscal year, and I'll be requesting things probably in the fall.
Awesome.
That's what's coming to mind, because we have all these new township mental health boards that have just come into play, and one of their big items is their needs assessment. So I was thinking, like, if they needed to access that, we would just have them contact you and request information. And okay, that's great.
Yeah, for sure. And we can do, all of the categories that I mentioned there. I dove into mental health a little bit more, but we can do a breakdown of the subcategories as it relates to emotional abuse, right? Or family dynamics, like what are those? So all of that's, I think, super relevant, and we can break down I showed you the age of callers reaching out about mental health, but we can do that for the other demographic data points as well. It's all really reflective of what folks need and want.
Right. And they should also reach out to you, Andy, because, every municipality in Illinois has a comprehensive community-based youth service provider who responds within an hour or 2 hours, depending on if it's urban or rural, on a missing runaway, throwaway youth who shows up at a police station. So now that, we've got about 10 new mental health boards that are doing their needs assessment, they for them to make that a priority, they will then fund the things that they see as a priority. And if they don't know about it, they won't fund it, and it's new funding.
Yeah, I'm happy to collaborate in whatever way we can to help address the needs of young people.
Yeah, because Jody could just give your email out and a little bit of information on ICOI, and then you can, if they contact you, you can let them know who the local provider is, and as well as National Runaway Safeline and any RHY funded programs that are in the area.
Mhm.
That's great.
Well, thank you very much. I've got to go too,
I appreciate the time. It was great, very informative, and
very much.
yeah, definitely. I'm sure I'll be in touch with some
Of
follow-up.
course. Thank you all so
Appreciate
much. I
it.
really
Thank you.
appreciate your time. Thanks for listening.
Thanks so much.
Bye.